Welcome back, guys. Let's go further to question number 51. Are you there, guys? Everyone? Chalo. Now, a patient is presenting with feature of autophony. Autophony means hearing your own sound, and the TM is normal, but TM is moving with respiration. This is a typical scenario of the patulous eustachian tube. Patulous means weak. Now, please see, eustachian tube only opens during swallowing with the help of tensor villi palatini muscle. Eustachian tube is naturally closed tube. It only opens during swallowing with the help of tensor villi palatini muscle. Okay. But if it is always open, it's called patulous. Now, patulous eustachian tube means weak. It is weak tube. Weak means always open. Lax. Always open. Hamesha khuli rehti hai. Okay. It is seen in pregnancy. P for patulous, P for pregnancy. And the other cause is rapid weight loss. Mainly pregnancy. This number 2 is the rapid weight loss. And the chief complaint of this patient is autophony. Why? Because the sound keep going into your ear from your eustachian tube area. Autophony. Number 2 is feeling of movement of tympanic membrane with respiration. Feeling of movement of tympanic membrane with the respiration. Feeling of movement of tympanic membrane with the respiration. Feeling of movement of Dr. Dhawan, whenever I breathe, I feel TM is moving because air keep entering the middle ear from that side. So that's why TM is moving with the respiration. The typical question of this answer is patulous eustachian. Autophony, autophony is typical question. Autophony is for the patulous eustachian tube. Now, question number 52. Now there is a software engineer who's 30-year-old. He has history of right side ear discharge, and the ear discharge is foul smelling. The foul smelling ear discharge for last 10 years, chronic foul smelling ear discharge. This is a typical, history for unsafe CSOM, also called aticoantral CSOM. Unsafe CSOM or aticoantral CSOM. Okay. And now he has developed vertigo with nausea, vomiting for last 3 days. Okay. Well, nausea, vomiting for last 3 days. Nausea, vomiting for last 3 days. Okay. Now, the vertigo means some inner ear problem with it. Now, unsafe CSOM, the other name is aticoantral CSOM. Basically, it is the presence of cholesteatoma. If you remember cholesteatoma is skin in the middle ear. Cholesteatoma is skin in the middle ear, and cholesteatoma is got bone eroding property. Cholesteatoma can eat away the bone. Cholesteatoma in the middle ear, right brain middle ear, inner covered with the bone, and cholesteatoma over years. What will do? This is the inner ear, and inner covered with the bone. And cholesteatoma is sitting in the middle ear. It will eat away this bone, which is covering the lateral semicircular canal, and the actual canal get exposed over there. Now, canals are meant for balance. Now, there is this fistula is called labyrinthine fistula. What is labyrinth? Inner ear. What is fistula? Erosion. And this fistula is mostly of the lateral semicircular canal. Okay, labyrinthine fistula of lateral semicircular canal. Labyrinthine fistula of lateral semicircular canal, and the chief complaint will be vertigo. So chronic foul smelling ear discharge with the vertigo, the diagnosis is labyrinthine fistula of lateral semicircular canal. In this case, fistula sign is positive. Now, what is fistula sign? Fistula sign is best seen with seagulization. What is seagulization? Putting air pressure in the ear. When you put air pressure in the ear of this patient, air will enter the inner ear from here. Air will enter the inner ear from here. It will stimulate the inner ear, and you get vertigo, and you see nystagmus in that patient. This is called positive fistula sign. Positive fistula sign. So this patient has got chronic foul smelling ear discharge for last 10 years. And he has got vertigo with nausea, vomiting. Every vertigo has got a little bit nausea, vomiting. So the answer of this question will be the aticoantral CSOM, which is the other name of unsafe CSOM, with the lateral semicircular semi-cervical fistula. Lateral semi-cervical fistula. Fine. Everybody, could you solve this question, madam? Could you solve this question? Okay, fine. Now, so 52 answer is B, beta, B. Now, let us revise, beta. Let us revise, everybody. The unsafe CSM and its complication, beta. Chronic foul-smelling ear discharge is a direct hint for unsafe CSM, also called aticoenteral CSM. If the question says chronic foul-smelling ear discharge with vertigo, it means there's a complication of unsafe CSOM. So diagnosis will be aticoenteral CSOM with the labyrinthine fistula of lateral semicircular canal. Number 2, if the question says chronic foul-smelling ear discharge with headache, vomiting, convulsion, it means the diagnosis is aticoenteral CSOM with brain abscess. It is called otogenic brain abscess, and the most common site of otogenic brain abscess due to ear infection is temporal lobe, and the convulsions in ear discharge patient, headache, that point toward a brain abscess diagnosis, and the CCT, you see a brain abscess in the CT scan, and treatment of this situation is neurosurgery, not ear surgery. Number 3 is if the patient has got chronic foul-smelling ear discharge with edema on the mastoid, profuse ear discharge, tenderness on the mastoid, it's a mastoiditis complication. But if the MCQ says chronic foul-smelling ear discharge with the edema on the mastoid, along with edema, it says that there is spiky fever, which is called picket fence fever, with headache and with the pitting edema or edema on the mastoid, which is called Grissinger's sign. This is sigmoid sinus thrombosis, also called lateral sinus thrombosis, which is again a complication of unsafe CS1. So please keep in mind, edema on the mastoid is mastoiditis. But if edema on the mastoid with headache and with the spiky fever is given, then it is sigmoid sinus thrombosis or lateral sinus thrombosis. And one very important hint is, whenever in ear discharge, there is a headache mentioned, it means there is some intracranial complication of unsafe CSM in that case. Everybody, are you okay with that, beta? Fine. So, my dear friend, this is your ear. Ear lies in which bone, beta? Temporal bone. Temporal bone. And temporal bone has got cholestoma. If infection goes from here to here, there will be otogenic brain abscess in the temporal lobe. This patient will be having headache, vomiting, and very importantly, convulsions. Beta. Headache, vomiting, and convulsion will be there in the brain abscess. So treatment in this case will be neurosurgery. Beta. Treatment is neurosurgery. Neurosurgery. But if the infection goes backward towards sigmoid sinus, there's thrombus there. It's called sigmoid sinus thrombosis or lateral sinus thrombosis. The patient will be having headache. There will be spiky fever called picket fence fever, and there will be edema on the mastoid, and that is called Grissinger's sign. The fever is called picket fence fever, edema on the mastoid is Grissinger's sign. This is a diagnosis of sigmoid sinus thrombosis or lateral sinus thrombosis. Everybody, please mark who is there, beta. Everybody mark your attendance and tell me, could you understand this complication thing, beta? All MCQs covered. Brain abscess will be having headache, vomiting, convulsion, beta. And thrombosis of sigmoid sinus will be having headache, pitting edema on mastoid, spiky fever, beta. Okay, chalo. The answer to the question is B, beta. Now 53. School-age child has been diagnosed to be suffering from bilateral congenital sensory neural hearing loss since birth, beta. Now, which of the following would not be part of the possible treatment, not be the part of possible treatment for this patient, beta? Guys, any child who has got problem of hearing since birth, teacher will ask them to sit in the first class. Don't ask that student to sit in the last row, beta. Agar aapne usko last row mein bitha diya, wahan pe sunega nahi. So yes, preferential sitting in the first row in the class will definitely help him. Number 2, we always give first trial of hearing aid, beta. Yes. And if hearing aid does not help the patient, then we go for the cochlear implant surgery, beta. Cochlear implant. But Maringotomy grommet is not for SNHL, beta. This is done for glue ear, and G for glue, G for grommet, and glue ear will lead to conductive hearing loss. But this is the case of SNHL. The answer to this question is D, beta. How many of you, tell me honestly, attempted this question correctly? Please mark everyone in the group. How many of you attempted this question correctly? Oh, you did not read the not, not. Okay, fine. Okay. Please don't miss the word not, beta, hai na? Fine. Okay. Read it carefully, beta, hai na? Fine. Okay, not bad, not bad. Please do not get discouraged with anything in the last. Your GT score is less. Your mistake. Keep learning, beta. Keep learning. I'm still learning, beta. Look at me. I'm still learning ENT. I'm still learning from mistakes. I still get angry sometimes, but I'm still learning to become a better person. I still get, like sometimes I'm not behaving as very good human being. Sometimes I'm like little, but I keep working on myself to behave, to develop as a better human being. We should learn from mistakes, beta. We should not be discouraged by mistakes. Okay, fine. Now, interpret the odd diagram, beta. Now, please see. Now, let's see, beta. Now, please see. Is it right or left? Is it right or left, beta? This is right diagram. Why? Circle represent the air conduction of the right ear. Cross is the left ear. I left my X. Okay, fine. I like that somebody wrote it. So cross is for the left ear and the circle for the AC of the right ear. So this is, my dear friend, this is the, of course, air conduction. This is bone conduction. And bone, upper line always bone conduction. Bracket like symbol, bone conduction. Now anything above 25 is normal. BC is normal. AC is poor, below 25 poor, and this gap is called AP gap. So it is conductive bearing loss of the right side. The right side conductive bearing loss. Right side conductive bearing loss is the correct diagnosis in this case. I hope you could interpret this one better. I hope you could solve this question. This was like testing your knowledge about your symbols and all that. This is D. Everybody clear, better? Fine. Now, again, the tuning fork test, better. The symbols of the right ear, always see AC, but air conduction symbol, right is cross, right is circle, left is cross. Air conduction symbol, but air conduction symbol, cross will be right ear, air conduction. Cross, so circle is round, but circle will be air conduction right ear. Cross will be air conduction of the left ear. Now, patient complaint of right side hearing loss. Tuning fork test shows that Rin is negative on the right side and Weber on lateral is on the left. All of you look at me. Look at me. What is Weber test, beta? We keep the tuning fork in the center of the forehead and ask the patient which side you are hearing it, beta. Okay, if you remember, we said that Weber is heard in the poor ear in conductive hearing loss, beta. Just write basic line, beta. Poor ear is ear with hearing loss. What is poor ear? Ear with hearing loss is poor ear. In this case, right is the poor ear. Right is the poor ear because patient says that I have got right side hearing loss. Right is the poor ear. What is poor ear? Poor ear is the ear with the hearing loss. Other ear will be better ear. I think that's understandable. Poor ear is the ear with the hearing loss. Okay, and the other ear is the better ear. Now, look at me, all of you, let us understand the Weber. Let us understand the Weber. Now please let us understand the Weber. Weber. All of you keep the 24 in the center of forehead. Which side you are hearing it, beta? In conductive hearing loss, this sound is heard in the poor ear only, means ear with the hearing loss. Let us produce conductive hearing loss on our one ear, beta. Right now, everybody close your tragus, beta. Close your tragus tight. Right now, this is the poor ear. This is conductive hearing loss being created by me by closing the tragus. Everybody now say 1, 2, 3. 1, 2, 3, beta. Say 1, 2, 3. Are you able to hear your own sound on this side? Are you able to hear your own sound on this side, beta? Are you able to hear? Okay, this will remind me, this is right now poor ear. This is suffering from conductive hearing loss, which I created on me, and my sound is heard on this side. It will help me recall in the exam. If Weber is heard in the poor ear, it's conductive hearing loss. SNH will always the reverse of that. Okay, and my dear friend, the third test is absolute bone conduction. When you check the bone conduction like this, please see. Bone conduction like this, please see. Then bone conduction directly reaches cochlea. Bone conduction checks cochlea only. Bone conduction directly reaches cochlea. Bone conduction checks cochlea only. Therefore, bone conduction will be poor in SNHL. SNHL. Once again, 3 sentences to remember about tuning fork. Rene negative is conductive hearing loss. मतलब bone conduction better than air conduction. This is the most important line, beta. Weber heard in the poor ear is conductive hearing loss. And ABC poor decrease means SNHL. Generally, you give the finding of first two, beta. Rene negative, please, beta. Rene negative is conductive hearing loss, beta. Rene negative is conductive hearing loss. BC better than AC. Number 2, Weber heard in the poor ear means conductive hearing loss. Number 3, beta. BC poor means SNHL. BC poor means SNHL, beta. Now, please see, beta, please see. Now, let us see 3 questions, beta. If Rene, forget about normal, beta. This is Rene. This is Weber. This is ABC, beta. Forget about ABC. These 2 tests are important, beta. Now, Rene given negative and Weber is heard in the poor ear, it's conductive hearing loss. If Rene is given negative and Weber is heard in the poor ear, it's conductive hearing loss. If Rene is given positive and Weber is heard in the better ear, it's sensory neural hearing loss, beta. If Rene is given positive and Weber is heard in the better ear, it's sensory neural hearing loss. Okay, but the problem comes in a situation which is false negative Rene. Let's write beta false negative Rene. Rene is wrongly negative, beta. False negative Rene is a feature of unilateral severe SNHL. False negative Rene is a feature of unilateral severe SNHL. Too much of SNHL, beta. Unilateral severe SNHL. Now please see, beta, please see. This cochlea, all of you please. This is normal cochlea, beta. This is unilateral severe SNHL, means this cochlea is almost gone. Okay, I asked the patient, can you hear this? This cochlea is gone, unilateral severe SNHL. I asked him, can you hear this? He said, no, I cannot hear this. I asked him, can you hear this? The bone condition? Yeah, I can hear this. BC better than AC. Rene negative. That's conductive hearing loss. You are saying he is suffering from unilateral severe SNHL. Ask the patient again properly. Tell him again, one more time, test it. Can you hear this sound? He says, no. But can you hear this sound? He says, yes. Ask him, which side you are hearing it. Usko pucho, kidhar sun raha hai? He will tell you, Dr. Dhawan, I'm hearing this sound not on this side. I'm hearing this BC sound on this ear. Why? This cochlea is gone, beta. This cochlea is gone. This is bone conduction, beta. Skull is also bone. Some bone conduction sound goes via the skull into the other cochlea. And that creates a confusion, beta. So why false negative Rene come? This is due to transcranial migration of sound to the other cochlea when BC is checked on the disease site. That's why false negative Rene come, beta. So now please, beta, once again, if Rene is given negative and Weber in the poor ear, it is conductive hearing loss. But if Rene is given positive and Weber in the better ear, it's SNHL. The third one is if Rene is given negative and Weber is heard in the better ear. Look at it. Rene negative will say conductive hearing loss. Weber better ear will say SNHL. Then you cannot make any sense out of this. Then it's a question of false negative Rene. Kyun? Agar Rene genuinely negative hota, if Rene would have been genuinely negative, then Weber would have been in the poor ear only, beta. But if Rene is given negative and Weber in the better ear, it's a case of false negative Rene, and that is due to unilateral severe SNHL. Unilateral severe SNHL. Unilateral severe SNHL. Okay, but fine. Unilateral severe SNHL. Unilateral severe SNHL. Okay, fine. Now, everybody, let's move on. Now, everybody, let's revise it up. Tuning fork test summary. Most commonly used tuning fork is 512 Hertz. Rene is comparison of air conduction and bone conduction. Rene negative means conductive hearing loss, means bone conduction better than air conduction. Weber heard in the poor ear means conductive hearing loss, and absolute bone conduction decrease means SNHL. So if Rene is given negative and Weber is heard in the poor ear, it's conductive hearing loss. Number 2, if Rene is given positive and Weber is heard in the better ear, it's sensory neural hearing loss. The third one is if Rene is given negative, but Weber is given in the better ear, then it is a case of false negative Rene. It is the seen in unilateral severe sensory neural hearing loss. Am I clear to fine? This one is okay, everybody clear? Now let us look at this one. Everybody comment, beta. Could you relate to this, beta, what we did just now? So let's evaluate this question now, beta. Rene, patient is coming to right side, beta. Right is the poor ear. And Rene test is negative on the right side, beta. Right is a so Rene is negative means conductive hearing loss. But Weber test is heard in the left ear. Left is the better ear, beta. Better ear, beta. But Weber is heard in the better ear, beta. This means SNHL. Whenever Rene is negative, but Weber is heard in the better ear, and this is nonsensical situation, then it is false negative Rene question, and the diagnosis of this is the severe SNHL. B is the answer, beta. B is the answer. B is the answer, beta. Am I clear to fine? Am I clear to fine? Is this okay? Could you solve it? Look at this question, beta. If Rene would have been genuinely negative, Rene in this case is negative on the right side, then Weber should have been the poor ear. If Rene would have been negative, genuinely negative, then Weber should have been the poor ear. But Weber has been lateralized to the left side, beta. Left is the better ear. So in this case, Rene is negative, but Weber is heard in the better ear, and these two are reverse thing, beta. It means Rene is a false negative Rene. So the answer is the right severe SNHL. Why severe, beta? Because false negative Rene is a feature of unilateral severe SNHL. So once again, beta, everybody, Divyanshi, Malavika, save this audio, beta. Save this audio and hear it 2-3 times, beta. Save this audio and hear it 2-3 times, beta. Okay, fine. Once again, I'm telling you, it's not difficult, beta. All of you look at the Rene negative, beta. First of all, say Rene, look at the Rene first. If Rene is negative, then look at Weber. And Weber is also given in the poor ear, conductive. But if Rene is negative and Weber is the better ear, it's the false negative Rene, and the answer is unilateral severe SNHL. बहुत इजी होता है बेटा, ज्यादा टेंशन मत लो इसमें. देख के पहले Rene नेगेटिव है, कंडक्टिव. चेक Weber बेटर ईयर में कि Weber पुअर ईयर में, Rene नेगेटिव, Weber पुअर ईयर में, कंडक्टिव. If Rene negative and Weber in the better ear, reverse situation, it's false negative Rene due to unilateral severe SNHL. चलो ज्यादा दिमाग में लगाओ इसमें यार. फिर the patient has got a non-healing ulcerative lesion on the pinna. Any ulcerative lesion on the nose or pinna is basal cell carcinoma. Basal BCC beta, rodent ulcer. Any ulcerative lesion on pinna or the nose is basal cell carcinoma beta. Any ulcerative lesion on nose skin or pinna skin is basal cell carcinoma. Also rodent ulcer. This is the basal cell carcinoma of the nose. So any ulcerative lesion on the nose skin or pinna skin is basal cell carcinoma. Rhinophyma. Rhinophyma. This is rhinophyma. Now rhinophyma is the hypertrophy of which gland? But anybody? Hypertrophy of which gland? Anybody? Hypertrophy of which gland? Sebaceous gland. Beta. Hypertrophy of sebaceous glands of the skin of the nose. It's not a tumor, it's a type of acne rosacea. And it is more common in males. It is more common in males. Okay, rhinophyma. Now, 46-year-old male presented with the right-sided nasal obstruction. Nasal endoscopic examination shows the polypoidal mass in the posterior part of the nasal cavity. This mass is better visible on posterior endoscopy. Any nasal mass better visible on posterior endoscopy, it is a direct clue for enterocoinal polyp. Enterocoinal polyp, also called Killian's polyp. Now let's revise it. Enterocoinal polyp. What is antrum? Anybody? Antrum is other name of maxillary sinus. What is coena? Coena is the posterior opening of nasal cavity. So this polyp actually arises from maxillary sinus, and then it comes to nose, and it does not grow anteriorly, but it grows posteriorly backward towards coena. Any nasal mass growing backward, better visible on the posterior examination of the nose, is enterocoinal polyp. Now this is the unilateral nasal mass. Only on one side, beta. Okay, it's a single nasal mass growing backward. Unilateral nasal mass, single nasal mass growing backward, beta. And most importantly, beta, no epistaxis, beta. Polyp never bleed. Polyps do not bleed. No epistaxis. Unilateral, single nasal mass growing backward. No epistaxis, beta. This is due to infection, beta. This is due to infection. The treatment of this is FES or endoscopic polypectomy. And functional endoscopic sinus surgery, mainly endoscopic word should be there, endoscopic surgery. Endoscopic surgery. Guys, try to differentiate enterocoinal polyp versus ethmoidal polyp. Ethmoidal polypi were allergic polypi. They were multiple bilateral. And we gave the steroid spray in that. Steroid spray. Steroid spray in that. Okay, fine. Now let's see about enteroconal polyp versus ethmoidal polyp. Enteroconal polyp is due to infection. It is single mass, unilateral mass, growing backward. Okay, and treatment is surgery called FES or endoscopic polypectomy. Ethmoidal polypi are allergic polypi. There are multiple bilateral polypi. Treatment is not surgery, treatment is steroid spray. Okay, but do keep in mind, whichever polyp it may be, polyp never bleed. Guys, the answer to this question is enterocoinal polyp. Why it is not ethmoidal polyp? Now, ethmoidal polypi, please read it. Ethmoidal polypi would be multiple and bilateral. It's a right side, one-sided. Multiple bilateral. Multiple bilateral, not a single mass. It does not grow backward. Any mass growing backward is better visible on posterior endoscopy is enterocoinal polyp. What is coena? Back opening of the nasal cavity. Okay, fine. Okay, and it's definitely not inverted papilloma because these two will be having epistaxis. These two will have epistaxis. My dear friend, first A and B, right now, A and B will be having epistaxis. And you know, rhinosporidosis will have a typical history of going to pond water. It's infection by Rhinosporidium sebrae. But you know, both of them will be having epistaxis. Polyp, these two polyp never bleed. The polyps do not bleed. That's how we reach a diagnosis of enterocoinal polyp. Okay, so 57, the answer is C. 57, the answer is C. Next one, which the following is not sacrificed in the radical neck dissection modified R&D type 3. Important question. Radical neck dissection and R&D and modified R&D. Let's revise R&D and modified R&D. What is R&D full form? Let's revise. Radical neck dissection is a surgery done for secondary neck nodes. Radical neck dissection is surgery done for secondary neck nodes. Various structures removed in R&D are, first of all, level 1 to level 5 neck nodes. Number 2 is the sternocleidomastoid muscle. Number 3, internal jugular vein. Then accessory spinal nerve. Then omohyoid muscle. Omohyoid muscle. Then tail of parotid gland and submandibular salivary gland. Submandibular salivary gland. Okay. So R&D is really radical. Okay. Then modified R&D is R&D only, but few structures are saved. If you do R&D and if you save the 11th nerve, it's called modified R&D type 1. If you save the 11th nerve also plus the internal jugular vein also, it's called mRND type 2. If you save the nerve also, vein also, plus sternocleidomastoid muscle also, it is called modified R&D type 3. This is important, beta. In R&D, they ask you like this, beta. All are removed in R&D except in mRND, they ask you what are saved structures, beta. What are saved structures? What are saved structures, beta? Okay, now let's revise radical neck dissection. The various structures removed in R&D are number 1, level 1 to level 5 neck nodes. Number 2, sternocleidomastoid muscle. Number 3, internal jugular vein, excess spinal nerve, omohyoid muscle, and 2 salivary gland, tail of parotid gland and submucous salivary gland. Modified R&D is R&D only, but we save few structure. If you do R&D, but you save the excessive spinal nerve, it's called type 1 modified R&D. If you save excessive spinal nerve and internal jugular vein, it's called type 2 mRND. And if you save the excessive nerve and vein and sternocleidomastoid muscle, it's called type 3 modified R&D. So I think answer in this case is very clear. Type 3 is asking, the A is the answer. A is the answer. So modified R&D type 3, what is not sacrificed, but not sacrificed, saved. Okay, fine. Any doubts, beta? Any doubt till now, beta? Yes, Ashwin. False negative रहने मतलब you're testing the disease here only, beta. Yes. So COVID-19 patient on high dose of steroid methylprednisolone. They present to ENT OPD with blood stain nasal discharge and progressive blackish nasal discoloration. Beta. So 2 risk factors are there, COVID-19, then methylprednisolone, and we know already it's mucormycosis. Blackish color also, mucormycosis, and we'll go for liposomal amphotericin B. Anybody who marked A? Anybody would like to accept in the Telegram chat that I marked A? Anyone? Okay, so it means that they're learning over here. Learning over here. Somebody is writing that 142, 143, beta, 142, 143. It's very, like very close to passing. Only thing is decrease silly mistake, beta. Read till the last choice. How so? Yeah, please understand that, if you are familiar with something, give it more importance. Beta. Okay. So you'll automatically, let's try mucormycosis, beta. First of all, mucormycosis, what are risk factors, beta? Now let me summarize. Everybody hear me carefully. You've done it. Everybody hear me. Mucormycosis is seen in number 1, uncontrolled diabetic patients. Number 2, HIV positive patient. Number 3, RT-PCR COVID-19 positive patients. Then neutropenic status, high steroid therapy because steroid lead to immunosuppression. Any drug which is causing immunosuppression will be a risk factor for mucormycosis. Mucor killed so many people. Why? Because mucor is angio-invasive fungus, means it grows into the blood vessels and via blood vessel, it reaches from nose to orbit and brain. Hence, it's a life-threatening infection. Now, angio-invasion means blocking the blood vessels will lead to ischemia, necrosis, and therefore blackish color of tissues, which came after a few days. But the early inflammatory color is red only. What are the early symptoms or signs of the mucormycosis? Number 1, redness over the cheek, pain over the cheek, numbness over the cheek. Number 2, eye swelling, blurring of vision or visual disturbance. Then nasal discharge, which is blood stain and nasal obstruction. And very importantly, loose upper teeth are there. Because upper teeth are also attached to base of maxilla and mucus is filling the maxillary sinus only. But few days later, black color come. So black feature will be blackish nasal mask or blackish discoloration around the eye. The best investigation to prove mucormycosis is not nasal swab for fungal smear. It is biopsy. The biopsy will tell you the characteristic feature of the mucor. If you remember, mucor is aseptate hyphae. Aspergillus is septate hyphae with 45-degree branching. So biopsy is the diagnostic thing. If biopsy is not given in the question, then second best answer for best investigation would be contrast MRI, and contrast MRI shows black turbinate sign. The treatment of choice is liposomal amphotericin B plus debridement. This is black turbinate sign, beta. This one. Please, Yoda. This is the normal side. This is the mucor in the maxillary sinus. Normal. You can compare these two turbinate. This is the black turbinate sign. Black turbinate sign. Black turbinate sign. How many marks in this test would be good, beta? Anything which is crossing, like you should be, at least in this paper, if you revise the ENT properly, you should be crossing, 45. 40, 45 is okay. You can still improve, but you should, because there were many no question in this. It's not like unknown things, but it's all in the notes actually, more or less. Okay. Now, everyone clear, beta? Fine. Are you clear about mucormycosis, beta? Young diabetic patient, steroid usage, beta. One question was, which of the following has no risk potential for mucormycosis? Antibiotic therapy has no risk potential for mucormycosis. Beta, fine. 6-year-old child present with history of mouth breathing and dental alignment issues, disturbed sleep and dull voice. Please see, beta. Again, the moment you see mouth breathing child, it's adenoid hypertrophy question, and adenoid hypertrophy will have a typical look called adenoid face. The open mouth, crowding of upper teeth, malalignment of teeth, and etc. And disturbed sleep because the child is having snoring also at night. Sleep apnea may be there. The best method of adenoidectomy is coblation. Coblation. Then the name of surgery is adenoidectomy. There are various methods of adenoidectomy. One of them is the old method. Write down. Old method is curettage. Curettage by Saint Clair Thompson adenoid curette. But curettage is a blind surgery. Blind surgery, so more chance of complication and bleeding. Okay, curettage is a blind surgery, so more chance of complication and bleeding. You see, that's the curettage. You put a curette in the mouth of the baby and you just scoop it out like that. It's a blind surgery and there's a lot of complication possible and a lot of bleeding also. This is old method, curettage. But the new methods are like coblation. What is coblation? Controlled ablation. This is a coblation wand which we use to remove the adenoid, burn the remaining tissue. That's the coblation, the controlled ablation. Controlled ablation. Okay, fine. This is the best method of surgery. This is coblation. Now, what are new methods of surgery? The new methods are number one, coblation. That's the best method. Number two is suction diathermy. And number three is microdebrider. Put an arrow. These three are endoscopic surgeries. These are endoscopic surgeries. So less bleeding and less complications. Less bleeding and less complication. Fine. Okay. Now, so the best method is coblation. Now, which is following is correct sequence of auditory pathway from cochlear nucleus to auditory cortex. I think we know auditory pathway lies in the brainstem area. Auditory pathway lies in the brainstem area, and the mnemonic of that is E. coli. E. coli. E. coli. E for 8 now. E for 8 now, beta. E for 8 now. Also, you can write spiral ganglion of 8 now, beta. They might change the word to spiral ganglion, beta, because spiral ganglion is like the modulus of the cochlea, and that's the beginning of the 8 now, beta. Number 2 is C. C is cochlear nucleus. O is olivary complex superior. L for lateral lemniscus. I for inferior colliculus. M for medial genital body. And A for auditory cortex. Once again, E for 8 nerve or spiral ganglion of the 8 nerve. C for cochlear nucleus. O for olivary complex superior. L for lateral lemniscus. I for inferior colliculus. M for medial geniculate body. And A for auditory cortex. So that's what the sequence is. Now, such questions are tricky questions. Even if you know them, should be careful about them. Now, please see how to solve this question. First of all, let us first of all make 4 to 2. 4 to 2, beta. 4 to 2, beta. Now, let's always practice without pens and all, beta. You will not have anything over there. All practice like that, because with pen is different, beta. With pen, you can cut like, okay, this is not like that, huh? Okay, fine. Now, please see, beta, please see. Everybody. So, how to do, beta? First of all, look at D, beta. Right? Just keep in mind, E. coli. I is inferior colliculus. Inferior colliculus cannot come in the beginning, beta. O has to come before I, beta. So this is wrong, beta. O has to come before I. So this is wrong, beta. Let us go to C now. 8 now is okay. Then inferior colliculus, beta, I. Then again, olivary complex, beta. Again, O has to come before I. C is also gone, beta. Then come the third one, beta. The superior olivary nucleus, O, okay. Then spiral ganglion, beta. That is not really. Then E is spiral ganglion, huh? Then E should come before O. That's also gone, beta. The only left is one, A. Now let's see the A. Spiral ganglion is E, 8 now. Now C is not given, O. Olivary complex, this is nucleus, okay, O. Then L, lateral lemniscus. Then is I, inferior colliculus. Then M, medial genital ganglion. And then auditory cortex, beta. The answer to this question is A. A, beta. The answer to this question is A. Everybody, can you tell me, did you attempt this question correctly? Yes or no? Because they are the question which you know in that context. You have to really 4 to 2, beta. First of all, bring 4 to 2. Like practice without pen and anything, beta. Pen and paper. That's saying that please give one GT and one mock in the exact same way as the real exam will be, in the same time frame and in the same day time also, which without using pen, exactly same way, beta. No watch, nothing. Just imagine it is your final day only, beta. Exactly. Don't watch any, no mobile, nothing. Everything sanitized completely. Chalo. So equalize. Now, let's revise a couple of things, beta. Right. A female patient with pulsatile tinnitus. Female patient with pulsatile tinnitus. Okay, Rikesh, thank you very much. Pulsatile tinnitus plus bleeding ear mass. This is glomus. It can be glomus jugulare or glomus tympanicum. Any lady with something pulsating or bleeding in the ear is glomus question, beta. There are two vascular tumor in ENT, angiofibroma and glomus. Both are benign, both are locally invasive, both are highly vascular, and in both biopsies contraindicated. If a young boy has nasal mass and profuse epistaxis, it's angiofibroma. If a lady has got something pulsating or bleeding in the ear, is glomus question, glomus jugular, glomus tympanicum, and the tumor grows from the in the middle ear from below upward, and that is called rising sun sign. Rising sun sign. Biopsy is contraindicated in glomus, just like angiofibroma. Okay, this tumor is red in color, but tumor blanches on seagulization. That is called brown sign. Tumor blanches, it turns pale on putting air pressure. It's called brown sign. Fine. Now, the next one is that rising sign and brown sign. Okay, this is the middle ear tumor. So there is conductive hearing loss. So Rene is negative. Glomus is in the middle ear tumor. Glomus is middle ear tumor. So there will be middle ear tumor lead to conductive hearing loss. Rene will be negative, but the bone conduction is better than ear conduction. Okay, fine. Now, next one. Let's try something about otosclerosis. How to see the diagnosis. Let me tell you, any young lady with bilateral hearing loss is otosclerosis question. You want to complicate your life, then it will be trouble actually. But you want to keep it simple, sweet, and clinical vignette kind of story in your mind. Young lady, with bilateral hearing loss is otosclerosis. Otosclerosis is bilateral disease mostly, and pregnancy aggravates otosclerosis. Any hearing loss worsening during pregnancy is otosclerosis question. Now, this is extra bone formation. The early bone formed is pink in color, and that is called the otospongiosis stage, and this gives Schwartz sign. Schwartz sign is pinkish appearance behind tympanic membrane, and that is seen in the early stage of disease. In early stage of disease, if Schwartz sign is positive written in the question, then surgery is not done. Drug of choice is sodium fluoride. So very carefully read. If they ask you treatment of choice of otosclerosis with Schwartz sign positive, then no surgery, sodium fluoride. Otherwise, treatment will be surgery. The best name of surgery is staphyectomy or staphyectomy. Staphyectomy or staphyectomy. Staphyectomy is a better word. Staphyectomy is a better word. Or staphyectomy. Now, in this surgery, we replace the fixed stapes with artificial stapes piston prosthesis. In this surgery, we replace the fixed stapes with artificial stapes piston prosthesis, which looks like a question mark. Okay, chalo. Now, let's go next question. Shantanu, 18-year-old young male, had deformed external nose after being hit with the cricket bat in a street brawl. He was brought to the emergency room immediately. X-ray has been done. Now, how to solve this question? Now, my dear friend, let us make it once and all for clear. Nasal trauma can lead to two clinical scenario-based questions. If nasal trauma is followed by nasal deformity plus minus crepitus, it's a nasal bone fracture situation. And if it is causing bilateral nasal obstruction, it is a septal hematoma situation. Because septal hematoma is a bilateral entity. Septal hematoma, we do treatment IND or aspiration of septal swelling. Okay, fine. Septal hematoma is bilateral entity, like this. Bilateral entity. This septal hematoma is both sides. So that's why bilateral nasal blockage after trauma is a clear-cut case of the septal hematoma. Don't leave it. Do the IND or aspiration. Okay. Now, but this patient has got trauma. But after trauma, he has got the deformed external nose and X-ray is also given. So there is a fracture over there on the nasal bone. So I have to do the fracture reduction. Now, fracture reduction, two questions. If swelling is mentioned in nasal bone fracture, if no swelling, and if no swelling is there, then the immediate close reduction should be done. If swelling is present, then wait for 7 days. If swelling is present, then wait for 7 days to let the edema subside and then do the fracture reduction. If swelling is present, then wait for 7 days to let the edema subside and then do the fracture reduction. Fine. So, please see over there, please see. So, this patient having the septal after trauma deformity, but no swelling is mentioned. So, in this case, we go for immediate nasal bone fracture reduction. Answer to this question is A. And we use which forceps? Walsham forceps. Which forceps? Walsham forceps are used for the nasal bone fracture reduction. Nasal bone fracture reduction. We use a Walsham forceps to reduce the fracture. Are these scenarios clear, beta? Everyone, are you clear about the scenarios? Everyone? Swelling will not be in the X-ray, beta. Swelling will be given in the MCQ, beta. X-ray does not show swelling. Swelling will be written in this clinical story over here, beta. Patient came after 2 days, is swelling and all that. Okay, fine. Manish? Now, 43-year-old male presents with a roomy nasal cavity, nasal crust, bad smell from the nose, with disfigured hard external nose. Disfigured hard external nose. Okay. Now I told you, beta, the first three will look like atrophic rhinitis question, beta. Atrophic rhinitis is crusting in the nose, bad smell from the nose, and roomy nasal cavity. I told you in atrophic rhinitis there is no outside change, beta. Okay. But atrophic rhinitis MCQ plus hard external nose, the answer will be rhinostroma or woody nose. Rhinostroma or woody nose. Okay, and if your biopsy is also given, beta, the biopsy shows very clearly what, beta? The biopsy shows Russell bodies and Mikulicz cell. When you take a biopsy from here, you see Russell body and Mikulicz cell. When you take a biopsy from there, is Russell body and Mikulicz cell. Let us revise rhinostroma. Rhinostroma is also called woody nose, and it is caused by a bacteria, Klebsiella rhinostomatis. The patient mostly come from North India, Uttar Pradesh, Rajasthan. The disease has 3 stages. Stages 1, 2, and 3. The first stage is atrophic stage, which resembles atrophic rhinitis. Therefore, some features are similar to that. Number 2 is granulomatous stage. Granulomatous stage is the hard external nose, which is called woody nose. And number 3 is stage of fibrosis. Fibrosis. Biopsy shows Russell body and Mikulicz cell. Please see, beta, these blue cells are Russell body, beta. Solid plasma cell like Russell body and large vacuolate cell are Mikulicz cell. And drug of choice is tetracycline plus streptomycin. Drug of choice is tetracycline and streptomycin. Tetracycline and streptomycin. Okay. Now, so this answer to this question is rhinostroma. Rhinophyma is potato nose, beta, not woody nose, beta. Potato nose. That is the hypertrophy of the sebaceous glands of the skin of the nose. Okay. And rhinospordosis will be a mass in the nose, history of bathing in the pond and all that. Okay. Sure. Now, let's go. Now, ready? In which disease we use the Gutsman's maneuver? Oh man, have guts, speak like a man. In which disease we use the Gutsman maneuver? Gutzman. Gutsman maneuver is used for the speech therapy of puberphonia. Gutsman maneuver is the speech therapy for puberphonia. Puberphonia. Okay. Now, number two. Heimlich maneuver. Heimlich maneuver is only used for laryngeal foreign body. Please do not use this maneuver for any other foreign body, beta. Laryngeal foreign body, the typical story will be while eating, patient has choking in the bracket plus aphonia. Choking while eating, choking while eating, choking, aphonia, like this, but choking while like choking, unable to breathe at all. Laryngeal foreign body. Heimlich maneuver. Please don't write Heimlich for esophageal foreign body, bronchial foreign body, tracheal foreign body, etc. Don't do that, beta. It's purely for laryngeal foreign body. The question will be while eating, there is choking and aphonia. Because the foreign body, food particles got stuck as laryngeal foreign body, and the vocal cord are unable to move, so there's no breathing possible, and patient is unable to speak. In Heimlich maneuver, we press the epigastrium in backward and upward direction. But laryngeal foreign body in a child, we don't do Heimlich, beta. We do back slaps. For a child 2 years of age, we do the back slaps, beta. Heimlich maneuver, beta. For the adult, Heimlich maneuver for adult. For a child 2 years, we do the back slaps. Back slaps. Now, foreign bodies, let us summarize all of them, beta. Foreign body in ENT. Esophageal foreign body will be having the child is playing and develop sudden throat pain and dysphagia, not dyspnea, no difficulty breathing, dysphagia. You get the X-ray done, and if it's the coin, the AP will show the full coin, and later will show the edge of the coin, and you plan for rigid esophagoscopy. But if it is a disc battery, then you do the urgent esophagoscopy. Number 2 is the tracheal foreign body. If the coin goes to trachea, you will see the edge of the coin in the AP view, and there will be a respiratory difficulty, which is very severe. Tracheal foreign body is a serious airway emergency. It will be very different from the esophageal foreign body. In that case, you need the urgent rigid bronchoscopy. Number 3 is the laryngeal foreign body. In laryngeal foreign body, you will be having typical the choking and aphonia while eating something. So that would need Heimlich maneuver. But for a child, we don't do Heimlich, we do the back slaps. Then come the bronchial foreign body. The bronchial foreign body is again airway foreign body when the foreign body goes from the larynx to trachea to one of the bronchus, and most commonly foreign bodies are found in the right bronchus. Patient history will be typically playing child, develop sudden cough and breathlessness. Cough indicates bronchial irritation, and the diagnosis is very clear from the history from the mother only. So get the X-ray done. Most common finding on X-ray will be collapse. And peanut is the commonest foreign body, and we do the urgent rigid bronchoscopy and removal. So these are various foreign body I've recorded and put in the group also for you. Next one, beta. The most common long-term complication of FES or septoplasty is nasal synecdoche or adhesion formation. Or adhesion formation. Nasal synecdoche or adhesion formation. What happened, beta? What happened? This is your septum. This is your inferior turbinate. When you do surgery, raw area form on both sides. Two raw areas want to fuse with each other by fibrosis, and this fusion is called synecdoche formation. This synecdoche adhesion formation. Which drug can be applied on the area to decrease Seineke formation? Answer is mitomycin C. Mitomycin C can be applied to decrease the Seineke formation. Mitomycin C can be applied to decrease the Seineke formation. Okay, so chipak jana, adhesion formation after surgery is very common, and we can apply this drug mitomycin C to decrease the Seineke formation. Next one, beta. Next one. Identify the nasopharyngeal area shown with the yellow arrow. Now this one is the use taken. First one is the nasopharynx area. Nasopharynx area, beta. This is nasopharynx. Adenoid are here, beta. This is A for adenoid in the center. Adenoid. This is your eustachian tube opening. Eustachian tube opening. Okay. Now this is the fossa of Rosenmuller. Fossa of Rosenmuller. Any arrow on the above the eustachian tube is the fossa of Rosenmuller. Now please see once again. Now this is fossa of Rosenmuller. This is the eustachian tube opening. Torus tubaris. Torus tubaris is this bulge around eustachian tube is called torus tubaris. Fine. Now, everybody please see torus tubaris. This one. And of course, this is the other side eustachian tube opening. You're fine. So this is answer is fossa Rosenmuller in this case. And torus tubaris we have seen, but eustachian tube opening is this one. Okay. Pariform sinus, I hope you remember. Pariform sinus is on the side of the any arrow on the side of the larynx. This is pariform sinus. This is a pariform sinus picture. Any arrow on the side of the larynx is pariform sinus picture. Pariform sinus picture. Pariform sinus picture. Everybody fine. Okay. What is the answer to this question, beta? Esophagus. Very good. Esophagus, beta, because ऐसे क्वेश्चन में गलती नहीं करना है बेटा, because this is what we do. Esophagus, बेटा ना? Esophagus, and we go for esophagoscopy in this case. Esophagoscopy in this case. Beta. Anybody will tell me? Killian dehiscence is in which muscle, beta? Killian dehiscence, which muscle, everybody? Killian dehiscence belong to which muscle? Inferior constrictor muscle between the fiber of thyropharyngeus and cricopharyngeus, beta. Between the fiber of thyropharyngeus and cricopharyngeus, and Killian dehiscence is a weak area. It is the area where the Zenker diverticulum is formed. So Killian dehiscence belong to which muscle? Inferior constrictor between the fiber of thyropharyngeus and cricopharyngeus. It's a weak area, therefore it is site of formation of Zenker's diverticulum. Zenker's diverticulum or pharyngeal pouch, very famous question. Everybody, last few days, keep the momentum more high, beta. How anxiety can be reduced, beta? The only pill I have for anxiety is more hard work, beta. You want to decrease anxiety? Please increase the hard work, beta. Hard work is the antidote to anxiety. I'm telling you from experience. You see, I'm again saying, चद्दर तान के सो जाना एसी चला के कि मुझे लो फील हो रहा है, सबसे आसान काम है यार. I want to tell you very clearly right now, that's easy. More hard work, मतलब fulfill your agenda. Last 10 days, but everybody, 26th June to 5th July, 10 days, keep for the last look. I'll also be coming, we'll be doing, I'm planning to do one session on Instagram, know the paper, to crack the paper, and the last 10 days, how to spend that, also do that, do that, but do as much as possible, better. Everybody cannot do, but surgery cannot be weaker, gynae cannot be weaker, pharma cannot be weaker, please get up in the morning and read one hour extra if you're weaker in this subject. Surgery, gynae, pharma can be pillar of your paper. Like, so don't let them go loose, bache. Okay, but fine now. Yes, beta. Which virus is implicated? Absolutely. ऐसे क्वेश्चन भी आएंगे बेटा. There will be some one-liner also, but what we do is we get too much negative about the long question statement. Why can't we write on the wall today? Even if I remember Dr. Dhawan's face 100 times in the paper, I will still pass the paper with the grace of the God, with blessing of parents. Why can't I be write that? Even if I see his face 100 times in the paper, because when you see my face, beta, when you don't type C question, beta, if you see my face 100 times in the whole day, still you will pass the paper with the blessing of your parents and Almighty. You can pass the paper. Only thing is 142, 143, 141, 147 are not the outcome of lack of knowledge, are the outcome of two things, beta. Number one is people start losing hope in between. That's a very bad thing. You have to become very stable warrior. Men train the brain to become one, like that. Number two, people start doing silly mistake in question number A and B because of question type C. But that's what we have to do. Please understand that this is the only way. अगर आप पूरा करने की कोशिश करोगे आखिरी दिनों में, it's impossible. If you want to do full syllabus revision, it's impossible. Go high yield. Go more PYQ topic based study. Don't watch too many videos. Just do your notes every day. Keep 2.5 to 3 hours only for MCQ based study. Make 50 question block, solve the 50 question and see the explanation of only those questions which you were wrong at. Go faster. But don't do one question, one explanation, one question, one explanation, not like that. 50 question, do 50 question, then only see that. Beta. Let's make a habit of doing 50-50 question set. There's a technique of making this happen, bache. And the best ingredient of that technique is we should know that I will not be knowing the whole of paper, but still I will pass the paper. Fine. Which syndrome comes to your mind, beta? Which syndrome comes to your mind with this? Anybody? Which syndrome? The eagle syndrome, long styloid process, touching which nerve? The ninth nerve. Long styloid process, touching which nerve? Ninth nerve, lead to throat pain, refer to ear. Okay, to find refer to ear. Beta. Throat pain, refer to ear. Beta. Diphtheria membrane. Beta. Diphtheria membrane, 3 point to remember. It's a pseudo membrane. It bleeds on removal and it extends beyond tonsil to other areas. Beta. Diphtheria membrane is a pseudo membrane. It bleeds on removal. It extends beyond tonsil to the surrounding area. It's a child which is generally very sick and is having fever. Beta. Fever is a febrile child. And don't forget the word bull neck. Beta. Bull neck. Don't bull neck. Matlab bilateral cervical lymphadenopathy. My dear friend, please do revise mumps. Mumps. Beta. Mumps from pediatric. Mumps from PSM. Beta. Do revise that. Mumps पे क्वेश्चन को expected होता है. Mumps बेटा parotitis, viral parotitis. Any swelling below the lobule of pinna is parotid gland swelling. Parotid is not in front of pinna बेटा. Parotid is below the pinna. Below the lobule of pinna, any swelling marked parotid gland swelling, viral parotitis. Just one thing in ENT I would like to tell you, mumps can lead to unilateral sensory neural hearing loss as a complication. You must have read that mumps can cause orchitis, etc. What complication mumps can lead to in ENT practice? Mumps can lead to unilateral SNHL in the child. Better. Please note it down. You fine? Now. Now. Mother Lilo. Walder ring is internal mucosal ring, beta. Outside neck node are not part of this Walder ring, bache. Now, Quincy will be coming in here. Now, next one, bache. 67. Now, 2-year-old child is brought to the OPD with sudden bout of cough and breathlessness. Sudden bout of cough and breathlessness, which he developed out of the blue. He was playing, suddenly his cough, he was playing with his toy, There's no other history of your parents. Now this is foreign body larynx, ingestion, bronchus, trachea. Cough, foreign body. Cough is indicative of what? Beta, foreign body. Bronchus. Bronchus, beta. Right is more common than left, beta. Bronchial foreign body are more than the right, because right is more in line with trachea, beta. And right is wider bronchus. Right is more in line with trachea. And the foreign body are more on the right side, beta. So peanut is the commonest foreign body. Vegetable foreign body are the commonest foreign body. Out of vegetable foreign body, peanut is the commonest foreign body. There are three types of foreign body in the bronchus: vegetable foreign body, plastic foreign body, and metallic foreign body. Now these, please see what please. This is your trachea and right bronchus, left bronchus. So this is your peanut, beta. Peanut. Now peanut, beta, please see. The peanut, please see what peanut. If no air will go, the most common X-ray finding will be collapse. 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 But sometimes the foreign body is little smaller in size. Foreign body little smaller in size. It does not, it allows the entry of air in the lung, but does not allow the exit of the air. That will lead to hyperinflation. So the finding in X-ray can be number one, collapse. Collapse is the commonest finding. Number two, it can be hyperinflation, because sometimes foreign body allow the entry of air, but not the exit of the air. Okay, right? Okay, to find now. Next, the third one can be normal X-ray. Normal X-ray. Okay, it's an airway emergency. You need urgent rigid bronchoscopy. Urgent rigid bronchoscopy. Why it is not foreign body trachea? Somebody is asking me. Foreign body trachea, it is more, like I can say, cough is more suggestive of bronchial foreign body. And bronchial foreign body are more common than tracheal foreign body. Because generally the foreign body go down into one of the in the bronchus, and they're more common. Then X-ray is also given, and then it will be like, but if X-ray is not given, still cough will be more suggestive of the bronchial foreign body. But we start debating, ये भी हो सकता है, हो तो सब कुछ सकता है, पर आंसर चेंज नहीं करना होता है. वो भी हो सकता है, ये भी हो सकता है. लेकिन what is asking? Most probable diagnosis, beta. Is tracheal foreign body possible? Yes. But what does he ask, beta? In this clinical scenario, what is the first possibility, beta? What is the most likely diagnosis, beta? Nobody is asking, telling the other are not possible. Yes, ingestion foreign body is not possible, beta. Foreign body larynx choking will be there, beta. But in this scenario with cough present, bronchial foreign body is the more common. Now, so don't forget choking while eating with aphonia is laryngeal foreign body, and we do Heimlich maneuver. Don't forget this picture, beta. Heimlich maneuver, we put the pressure on epigastrium in backward and upward direction. Fine. 67, beta. 22-year-old female patient was suffering from tonsillitis for last 2 days. Now she has developed trismus, muffled voice, and difficulty in swallowing. The oropharyngeal picture is there, beta. Now, the pictures are not classical, beta. I could have given you very, see, please understand that. It's very easy to make a paper. I'm telling you, you just pick it up from here and you just put it over here. For me, it is more easy. Let me tell you, beta. For me, see, this is much, much easier for me, I'm telling you. But my purpose is, beta, please understand that I have to give you the real-time picture, beta. This is, इसमें क्या होगा बेटा? अरे वाह, यूवुला टेढ़ा है, डॉक्टर धवन ने बताया था, क्विंजी लगाना है. But paper is not like that, my dear friend. Paper is something else. Let us really live the real paper, beta. Okay, the real paper pictures are always a little different, beta. But concept is all. If 70% of the concept is matching my concept, I will not change the answer. कई लोग बोलते हैं बेटा वहां पे यूवुला टेढ़ा तो है, पर उतना टेढ़ा नहीं है. That is what not to be done, beta. This is what is going to real. Patient does not come from books. No, question does not come from notes. Exact words not, better. I'm sorry for that. Not ऐसा नहीं कि notes से नहीं आएंगे, लेकिन exact. Patient do not come from books, better. Patient come from the population, and question directly does not come from the notes. Only very few straightforward question, but concept are there in the notes, better. Get ready for that. Don't word to word matching should be not done. Major beta trismus, muffled voice, difficult in swallowing, uvula is a little bit teda meda, and answer is quinsy, and other name of quinsy is peritonsillar abscess. Dr. Dhawan, I just remembered quinsy. I forgot peritonsil. It is peritonsillar abscess. It's collection of pus between tonsil and its pet. So basically, this is the collection of pus over here between the tonsil and its pet. And this pus is pushing everything on the other side. So number one, tonsil pushed medially. Number two, uvula pushed to other side. So angulated uvula or uvula drifted other side is first answer is quinsy, but there is no outer neck swelling in quinsy. No outer neck swelling in quinsy. Quinsy patient has got trismus due to spasm of medial pterygoid muscle. Trismus due to spasm of medial pterygoid muscle. Beta. Medial pterygoid muscle. Beta. Medial pterygoid muscle. Medial pterygoid muscle. Fine. Now, please understand. Please understand. The voice is called hot potato voice. Hot potato voice, many words for that, muffled voice, plummy voice. Okay. This is classically seen in quinsy only. The classic is seen in quinsy only. Okay. They're seen in many other disorder, I know that. But if they ask you hot potato voice, the feature of quinsy is the most likely answer. Okay. If this is an answer. Now, how about the parapharyngeal abscess? Parapharyngeal abscess is similar to quinsy. And along with that, there is outer neck swelling close to angle of mandible. So parapharyngeal abscess is quinsy-like MCQ plus outer neck swelling close to angle of mandible. So quinsy plus outer neck swelling close to angle of mandible will be parapharyngeal abscess. And Quincke disease is not quinsy, beta. Quincke is the edema of uvula, angioneurotic edema of the uvula. Quincke is uvular edema. Uvular edema. Now, anybody who has marked the Quincke, anybody who has marked Quincke, we discussed in the class also. Anybody? Okay, fine. So Quincke. ये स्वरूप क्या लिख रहा है सर आफ्टर टुडेस पेपर आई एम लाइक इससे ज्यादा तो कुछ नहीं आएगा भाई पेपर इज एडवांसिंग बट व्हाई I want to tell you not for ENT only beta for medicine surgery please grasp the essence of the question beta मतलब अगर आप सिर्फ essence को पहचान लेते हो if you diagnose sarcoidosis don't go nitty gritty and all that beta people are changing choices beta. Would you not agree with me? Whenever we change the choices, we mark common thing as rare and we lose the marks there. Whenever we change the choices, we mark common thing as rare, beta. Is that fine? Chalo. Now, next beta. A patient presents to OPD. A patient presents to OPD with complaint of bleeding from nose, nasal obstruction. कहानी लिखते रहेंगे ये लोग बेटा. देखो कितनी बड़ी अगर oh my god. अब देखो ये क्वेश्चन मैंने बड़ा सोच समझ के बनाया बेटा. सोचो रियल पेपर. Patient presents to OPD with complaint of bleeding from nose, nasal obstruction, difficulty in breathing. He gives a history of working as paddy field worker. Paddy होता है rice, धान. Rice. We sow the rice in standing water बेटा. मेरा तो घर गांव में था ना तो वहां चावल बीजते थे वहां पे चावल पे जब बीते थे पानी में खड़े होके वो कॉटिलिडस लगाते थे उसके प्लांट सो राइस फील्ड वाटर तो आ ही रहा है बेटा water contact the pond water maybe pond water the reddish mass seen and this mass is irregular beta fine and there's a biopsy finding this is useless picture given beta ये सिर्फ यूजलेस पिक्चर दे रखी, फालतू में पिक्चर छाप देते, बंदे बोलता यार इसको इंपॉर्टेंट, अरे ऐसे ही लिखा हुआ है, पैडी फील्ड वर्कर नेजल मास, यू नो आंसर राइनोस प्रोड्यूस ना, but rhinos produce beta, rhinos produce beta. Okay, guys, please catch the theme of the question beta. भाई फूल की खुशबू से फूल समझ आ रहा था, फूल की पत्तियां मत गिनो बैठ के, इसकी 36 पत्तियां क्यों नहीं है? अरे तुम्हें फूल की खुशबू से फूल समझ आ रहा है ना बेटा, पत्तियां 36 थी तुम्हारे पेपर में, अरे भाई 34 रास्ते में दो गिर गई होंगी, या 44 पत्तियां हो गई, तो तुम्हें क्या प्रॉब्लम है बेटा? फूल बड़ा ग्रो कर गया, तुम्हें क्या प्रॉब्लम है? प्लीज डोंट गो टू द 36 पेटल्स होनी चाहिए भाई। अरे खुशबू से समझ आ रहा है ना तुम्हें फूल? प्लीज कैच द रोज फ्रॉम द स्मेल, डोंट काउंट द पेटल्स। फाइन नाउ, so rhinos produce beta. So rhinos produces is caused by Rhinosporidium seabrai. Sea मतलब water. It is aquatic protozoa. Aquatic protozoa beta. Not a fungus, it's aquatic protozoa. It's found in the pond water. Patient is mostly from a village. Mostly beta. Villager. He is a farmer. History villager, farmer, some farming, paddy field, etc. कैटल, उसके पास गाय भैंसे भी हैं बेटा, कैटल, वो अपनी गाय भैंसों को तालाब पे लेके जाता है नहलाने के लिए, वहां पे खुद भी नहा लेता है बेटा। ओके, he takes his cattle to the pond for bathing and he takes the bath over there. Some water content is there, the water contain the Rhinosporidium seabrai, and okay fine, no, now this goes to the nose better. Okay, now please see the next one better. The patient can get nasal lesion, eye lesion, conjunctival, oral cavity, and genital mucosa. But the classical mass is what, beta? The classical mass is reddish. Reddish, beta. The classical mass is reddish. Firm. Reddish, firm. Nasal mass with irregular surface. Irregular studded surface, beta, studded. With whitish dots on it, beta. Sometimes they will like, keep writing a faltu cheezein, beta, whitish dots on it. Irregular studded surface hai na bhai. Okay, that's rhinosporosis beta. Okay, fine. Plus epistaxis beta. Plus epistaxis beta. It is polyp never bleed beta. Other masses bleed. Okay, epistaxis will be there. Treatment is surgery. After surgery, we give Dapsone. Rhinosporosis as D. D for Dapsone. After surgery, we give what? Dapsone. Yeah. The patient is generally from South India, Tamil Nadu, coastal areas. But this question cannot go wrong. But they'll give hint of water, some South India story, coastal areas of Tamil Nadu particularly, or they may say Rameshwaram. Beta. Rameshwaram is a coastal town in Tamil Nadu. So you should know a little bit like that. है ना? थोड़ा सा दिमाग लगाया करो बेटा, है ना? Just play with the blind smartness बेटा, smartness. पूरा पूरा नहीं match नहीं करना. And nasal mass is irregular surface, studded surface, bleeding is there. South India patient, village, farmer, pond is free, water content will be there. Surgery is a treatment after the Dapsone. Mass is reddish, firm with irregular studded surface. Okay, now next, let us revise one more thing, beta. The inverted papilloma. Inverted papilloma. Let us third mass, beta. Inverted papilloma or Ringett's tumor. Inverted papilloma or Ringett's tumor. This is really a tumor, beta. This is a tumor. The three nasal masses, beta. One is enterocoinal polyp, which grows backward, no bleeding. Second is rhinosporidiosis, which is South India patient, Tamil Nadu, coastal area, water contact, irregular mass, bleeding. Third one is this one, beta, inverted papilloma, beta, or Ringett's tumor. Now, this is more common in males in 40 to 60 years. It arises from lateral wall of nose. It has a lateral wall of nose, beta. And why it is called inverted? Because it grows inward, beta. Why it is called inverted? Because it grows inwards, beta. Inward. Look at this, beta. Are you getting my point, beta? This is the inverted papilloma, beta. Please see. The papilloma is growing from here, beta. Here. From lateral wall, and there's a bleeding over there. Okay, epistaxis, and it grows inward, beta. So the famous question is, inverted papilloma or Ringer's tumor is a benign but locally invasive tumor. Your exam question, beta. Benign but locally invasive tumor. Why it is called inverted? Because it grows inward, beta. Papillomas grow outward. Why it's called inverted papilloma? Because it grows inward. Therefore, it's called inverted papilloma, and therefore it's a benign but locally invasive tumor. This mass looks like this one, beta. The mass is a reddish, firm, and smooth surface, beta. Reddish, firm, and smooth surface. जो लीची का पार्ट हम खाते हैं व्हाइट वाला, वो एंट्रोपोनल पॉलिप. लीची का जो कवर होता है ऊपर वाला रेड कवर होता है, वो राइनोस्पोरियोसिस इरेगुलर. और जो आलू बुखारा होता है प्लम, प्लम इज द इन्वर्टेड पैपिलोमा और रिंगेट्स ट्यूमर. इन इंग्लिश, mulberry or strawberry like nasal mass, irregular surface, is actually the rhinosporidiosis. Okay, and this smooth surface mass like plum is the inverted papilloma. Yes, these three masses cannot be confused, beta. I'm telling you, beta. Please see, beta. And the first one again, enteroconal polyp. Enteroconal polyp will have no bleeding, first of all. Polyp never bleed. Polyp, this mass grows backward, better visible on posterior endoscopy, single mass unilateral. All are single unilateral. All three are single unilateral. All three are single unilateral mass, beta. Polyp, enteroconal polyp grow backward, no epistaxis, beta. Rhinosporidiosis, typical history will be again nasal mass bleeding. And the mass is irregular. Patient from village South India, and history of contact with the pond water is there. Okay, and inverted papilloma, no pond history, no South India history. It's a tumor actually. Why it's called inverted? Because it grows inward, therefore called inverted papilloma. It's also called Ringet's tumor. Now, next 69 question. 22-year-old female university student presents to emergency with sudden onset dysphonia, young female with sudden aphonia, and laryngoscopy, vocal cord failed to adduct on phonation, but on cuffing, the adduction of vocal cord is present. What is the answer, beta? What is the answer? Why you are saying speech therapy, beta? This is a psychological condition which is called the hysterical aphonia. Believe me, you are going to do much better in the real exam if you are channelizing yourself positively in the last part, beta. Don't count your mistakes. Learn from mistakes. Don't get depressed from mistakes, beta. Learn from the mistakes. Get alert. Get hopeful. Please, every day there should be hope within you. I'll make it this time. I'll make it with a good marks like that. Hysterical aphonia or functional aphonia. Hope is the only thing surviving everyone actually, beta. Functional aphonia, hysterical aphonia. They're saying that we're going to meet the NMC people on 18th of this month. Do you think anybody can give guarantee that they will agree to whatever rollback they're asking for? But at least we have to try with all sincerity. We have to put a point across with hope in our heart. Hopefully they will hear about it. But try has to be with hope. Hope has to be there within you. Be genuine in your preparation. If I go over there, I will tell the genuine thing, what trouble FMG people are facing actually because of the extended internship, no stipend scenario. So in every situation of life, you have to be at least maintaining a genuine hope within you. Same for you, beta. Don't predict a failure for yourself. This is injustice to yourself. Don't predict a failure. Stay hopeful, stay prayerful, beta. Stay hopeful, stay prayerful. If you can't be hopeful, at least stay neutral, beta. Neutral. So functional aphonia, hysterical aphonia, young lady with sudden loss of voice, and the patient is pretending the symptom of loss of voice. She's acting, beta. Why? Vocal cord movements are normal on coughing, beta. Coughing is normal. So treatment is psychotherapy, beta. It's a psychological problem. C is the answer, beta. C is the answer. So a young lady with sudden onset loss of voice. Okay, fine. Okay, to find function. The Hysterical aphonia or functional aphonia? Oh, it's D? No, no, no. It's C, beta. C. Psychotherapy. Psychotherapy, beta. Now, 5-year-old child presents with unilateral foul smelling discharge and epistaxis. Foreign body nose, beta. Foreign body. I'm telling you, any young child with smell from the nose, beta. Foul smell from the nose, beta. Foreign body nose, or the foreign body in the nose, it has been put few days back, beta. Maybe month back. Eraser in the nose, color in the nose. बच्चे नाक में डाल देते बेटा. They don't tell their parents something knows. After 1 month, what happened? Foreign body get infected, beta. From infected foreign body, the smell comes, the blood comes, the pus comes, and the same question comes. Look at the question, beta. 7-year-old child, 5-year-old child, 6-year-old child. Okay, to fine. Okay. Mohit, which other answer is wrong in the rice answer key? Let me know. Okay, only one answer I've been told by you. I'll ask them to correct it. Only one answer, but this one, 69. Every 69 answer is C. Anyway, you match with this one, beta. Don't worry. The foreign body knows, beta. It cannot be rhinolith, beta. Rhinolith will be more common in adult. Beta. Adult. Foreign body nose, star question, beta. Any child with smell from the nose on one side, or not one side, any child from smell from the nose is foreign body nose. Yes, 71 question, everyone. Very good, beta. Very good. Huh? Please see, beta. The mother says history of dysphagia. Dysphagia matlab patient is having esophageal foreign body. Okay, foreign body ingestion history there. Child is playing alone. X-ray done. Image. This is esophageal foreign body. The answer to this question is, of course, esophagus. Don't write Hamlich maneuver. For God's sake, this question came in the paper one time, and people said Hamlich is only for laryngeal foreign body. Beta. This is not airway foreign body. It is a foreign body in the digestive tract. I think you remember this one, beta. In the front, O for esophagus, beta. And lateral view will be edge of the coin. What a time, patience, beta. Patience. Now, this is integrated question of ENT with the microbiology. Now read, ऐसे क्वेश्चन भी कुछ आएंगे बेटा, थोड़ा दिमाग लगा के. A lady presented with complaint of nausea, vomiting, hypotension, rash, purulent secretion from the nose after 15 days of septic surgery, and she has missed the follow-up for pack removal, beta. She missed follow for pack removal. After any nose surgery, we put the pack in the nose. The pack maybe, after septoplasty, after FES, we put the pack. After 2 days, we ask the patient to come back to remove the pack. The patient did not come back. Any pack in the body should not be kept more than 48 hours. If you keep the pack for a long duration, then there can be toxic shock syndrome. Due to Staph aureus, this is almost patient going to endotoxic shock, and that's why there's a hypotension. It's a septicemic shock patient. Why? The pack becomes a culture medium for Staph aureus to colonize, and there's a state of shock because of the septicemia, and this is toxic shock syndrome scenario. Guys, how many of you attempted this question correctly? Please mark it, beta. Could you integrate this, beta? Very good. Now that shows that you're able to integrate the thing, beta. That's wonderful. You know what? You did not say, no, ENT, ENT sochna hai. No. ENT, integration medicine, and microbiology, toxic shock syndrome, beta. Very good. Now, next one, beta. Now, which is following is the correct site of artery brain implant, beta. ABI. ABI, beta. ABI. Auditory brain implant, ABI. Now, first of all, cochlear implant indication, beta. The cochlear implant indication is bilateral profound SNHL. Profound too much. Okay. But 8th nerve has to be normal. What is the precondition, beta? 8th nerve has to be normal, beta. Okay. On MRI. So you were having a patient with both sides hearing loss. You did MRI, you should see the 8th nerve normal, beta. But by chance, if you if you see the eighth nerve is not normal, and if you see there is a tumor of the eighth nerve, there is a tumor of the eighth nerve, and on the both side, it is a case of neurofibromatosis type 2 beta. If you remember, it's a case of neurofibromatosis type 2. Do you remember the neurofibroma type 2? Neurofibroma type 2. Neurofibroma type 2 has got bilateral acoustic neuroma. मतलब both eighth nerve got tumor. Both eighth nerve got tumor. Eighth nerve are not normal. So this patient cannot go for cochlear implant surgery, and this patient will be going for auditory brainstem implant. Okay. So the indication of ABI is neurofibroma type 2. Indication of ABI is neurofibroma type 2 beta. Okay, very good beta. And the location of implant is 2 into 2 fourth ventricle. Auditory brainstem implant, auditory brainstem implant, ABI. Auditory brainstem implant is, we put in which part of brainstem? In the lateral region of fourth ventricle. So let's revise once again, beta. Indication of ABI is neurofibroma type 2, which has got bilateral vestibular schwannoma. And the location of the implant is lateral region of fourth ventricle. Lateral is the fourth ventricle. Lateral is the fourth ventricle. Okay, fine. Now, everyone, if you are getting which date you are getting the centers for allocation? First, I think you will get the center by first or earlier than that, beta. First को मिल जाएंगे, center first को मिल जाएंगे ना, a week before they're saying, most probably before that. Yes, now that's very important. Exam is 6th, it's monsoon going on, or heat is too much. Please don't travel 5th evening, beta. That's not a good idea. That's not a good idea, beta. Because 5th evening, if you travel, reach hotel late, next morning you get up. Please try to travel 4th. It's better. 5th is buffer day, beta. Buffer day. 5th is buffer day for you. Don't go reckless, beta. मतलब ऐसे मत करो कि यार मतलब हो जाएगा, नहीं, प्लानिंग से चलेंगे. प्लानिंग से चलने से क्या होता है? टेस्ट, मेरी बात का यकीन रखना, मतलब मेरा 27 पेपर होगा ना इस बार यार. मतलब सच में बता रहा हूँ, ईमानदारी से बता रहा हूँ ये बात. जो लोग पास होते उनका कोई ज्यादा डिफरेंस नहीं होता उन लोगों से जिनके नंबर थोड़े कम रह जाते. ओनली थिंग इज टेक्निक ऑफ अटेम्प्टिंग पेपर. थोड़ा सा प्लीज मेंटेन सैनिटी विद इन यू यार. मैं तुम्हें फिर कह रहा हूँ बेटा, मैंने कह रहा मेनिया में चले जाओ बेटा, लेकिन थोड़ा सा कीप द माइंड लाइट. डोंट रियली लाइक क्रिएट हर बंदे से जा जाके पूछना यार मुझे बहुत डर लग रहा है. सबको डर लग रहा है बेटा. अगर मेरा एग्जाम होता तो डर तो मुझे भी लग रहा होता भाई. बट वी हैव टू मेंटेन द सैनिटी विद इन, एंड प्लानिंग हैज टू बी प्रॉपर बेटा. For the day of the exam, before the exam, when to travel. 5th ko. Why 5th is important, beta? Why? 5th, if you are traveling, you will be tired. 5th ko, we have to see, I'll put the schedule also. We have to see the images of radiology, pathology, microbiology, surgery, dermatology one more time. We will do the tumor staging, beta. Tumor staging of, gynae, surgery one more time with the treatment. Then PSM data we have to see one more time on the last day, beta. Some pharma 2 hour we have to see on that day. And then we have to rest also, beta. Find an air conditioned room, beta. जहां इतने पैसे खर्चे ना बेटा, एक दिन में पैसे बचा के, कुछ लोग याद आखिर में पैसे बचाने. नहीं सर, वो तो कूलर वाला कमरा ठीक था. अरे भाई, जहां इतना खर्चा हो गया ना बेटा, इतना खर्चा हुआ है ना, एक दिन और थोड़ा खर्चा कर लेते, क्या फर्क पड़ जाएगा? द कंफर्ट which you have in 4th or 5th will be absolutely changing the mindset on 6th. Don't keep it for the last hour. ऐसे मत करना. Sometimes raining and all that, फालतू में टेंशन नहीं. Please keep your passports and everything at a safe place with you. Last minute, no tussles, better. No tussles. All these things are as important as preparing for the paper. But please maintain the hope within you intact. I'm telling you, this is the art you have to learn and practice and adopt that. Adopt that. There is no other way for you. आप पेपर देने जा रहे हो, थोड़ा सा रिलैक्स होके कि I have read as much as possible. Now let's see what happens. Most probably first city you'll get it. Most probably they're saying first city. With number students are not that many actually this time. So most probably, most probably. Now, next one, McEwen triangle. McEwen triangle, sorry. McEwen triangle or suprameatal triangle. Yeah. McEwen triangle is a surgical landmark for which of the following in the otological procedure? Answer is what? Anybody what's the answer? Antrum of the mastoid. Antrum of the mastoid. All of you guys, this is your temporal bone, and this is my dear M is mastoid. Many air cells are there. This is one cell, largest cell is the antrum. There are other small cells also there. The largest and most constant cell is called antrum. 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 And antrum is connected to the middle ear via a tube called the adductus. Adductus connect the antrum with the middle ear. Okay. How to find the antrum during mastoid surgery? When we do mastoid surgery, we drill in that area. Okay. If you drill in this triangle is the landmark to find antrum. Patient lying down. If you drill in this area, you'll find the antrum. This triangle called McEwen triangle or suprameatal triangle. Supramedulla above EAC. Supramedulla above EAC. This is the external canal. This is right above the external canal. Suprameatal triangle, McEwen triangle is a surgical landmark for the mastoid antrum. And mastoid antrum is the most constant and largest cell of mastoid. For any mastoid surgery, the first cell to be found is antrum. Antrum. And another thing is over there is now for endolymphatic sac, the landmark is Donaldson's line. Donaldson's line is surgical landmark for endolymphatic sac. Donaldson's line is surgical landmark for endolymphatic sac. Donaldson's line is surgical landmark for endolymphatic sac. Anybody, in which disease you do endolymphatic sac surgery, beta? In which disease you do endolymphatic sac surgery? Anybody? In which disease the endolymphatic sac is the culprit, beta? Everyone answer. Meniere's. Yeah, the Meniere disease. Very good. Meniere's. Okay. And Donaldson line is surgical landmark for the endolymphatic sac. Now, 39-year-old female patient has developed spells of vertigo, particularly on taking the right side turn. Positional vertigo, female patient. And there is no history of hearing loss tinnitus. Okay. This is BPPV. Benign paroxysmal positional vertigo. Okay. Please see any vertigo on particular position is BPPV. And there is no hearing loss, no tinnitus in this patient. No hearing loss, no tinnitus in this patient. Which of the following will be used to rule out the most probable diagnosis? Answer is Dick-Solpike pneumonia. Now, once again, please see. This is the utricle. Anybody, this is the saccule, this is utricle. Anybody saccule and utricle control which type of balance? Linear balance or angular balance? Linear balance, very good. And saccule control which linear, saccule control which linear? Saccule control the vertical linear and utricle control the horizontal linear. Anybody, what is the sensory end organ of utricle and saccule? What is the sensory end organ of utricle and saccule? Anybody? Everybody, what is sensory end organ of utricle and saccule? The answer is what? The macula. Macula. It is covered by a gelatinous layer which has calcium carbonate crystals called otoconia or otolith. If otoconia turn free and reach semicircular canal, mostly posterior canal, the disease called BPPV, benign paroxysmal positional vertigo. What are various points to remember, beta? BPPV, let's summarize BPPV. Let's revise BPPV, benign paroxysmal positional vertigo. The cause of BPPV is displaced otoconia or otolith. They move from utricle sacularia to the semicircular canal, and most commonly they reach the posterior semicircular canal. The disease is more common in females, and the typical history is vertigo for few seconds only on changing the head position. There is no hearing loss, no tinnitus. It's a pure brief vertigo. There may be some nausea, vomiting given along with it. The diagnostic test, the diagnostic test is the diagnostic test of Meniere's is the diagnostic of BPPV is the Dick-Solpike maneuver, which has got two positions, and the treatment of choice is Apple's maneuver. Treatment of choice is Apple's maneuver. Apple maneuver. Apple. E-P-L-E-Y. Apple. But Dick-Solpike has got two positions. Dick-Solpike has got two positions over there. Two positions. And Apple maneuver has got 5 positions. Apple maneuver has got 5 positions. Now please just see quickly. Dick-Solpike maneuver has got 2 positions. 2 positions, sitting and lying down. And Apple maneuver has got 5 positions. This is a test. This is the test for BPPV. Best test to diagnosis is the Dick-Solpike maneuver for BPPV. 2 position, sitting to lying down. And nystagmus will come, vertigo will come. And treatment of choice of BPPV is Apple maneuver. 5 positions. Basically, you're trying to send the otoconia back from where they came. Otoconia back from where they came. I think we are done with that last question also. Yeah. Okay. Yes, yes. So that's the end of today's session. And I will just please understand that will these protests against NMC effect? Don't Malvika, everybody, don't really do all. NB is a different body, NMC is a different body altogether. Your exam is already, question already come, bache. This is all hypothetical, bache. Don't really do all this. August 2020 was toughest paper. Why it came? No reason was there. People related to the kind of things, don't really, don't really imagine all those things. Rather than wasting time, revise as much as possible. But I would, if I am you, what I would do, there will be rumors, and the most rumors spread during the last 2-3 weeks. There are panic news mostly spreading during the last 2-3 weeks. Guys, thoda samajhdari se kaam karte. Let's work with more wisdom, more conviction that I cannot read everything now, but I can read most important points of most of the subjects now. Every day I'll keep 2.5-3 hour MCQ based study program in tech. I will give 1 GT, 1 MOOC minimum in the remaining days. In the last 10 days, I will do the last look one more time. Paper, whatever paper may be, easy, difficult, more difficult, high difficult. Please understand that I'm coming from a background of 26 papers, that 190, 195 questions are always there, in fact, which are within your range. Only thing is, because by wasting your energy now, you will get less time to revise, couple of things. Now you read gynae and the same question comes, it's a high chance you'll be able to really, crack that question. But most important thing is, please keep the hope of passing alive within you. That's very, very important. These are psychological tricks which really work in the paper, and they're genuine. 150 out of 300 without negative marking is absolutely an achievable task. Only thing is, last mein aake, increase the number of hours study. Don't share the news, rumors and all that. Waste your time on all that. You do your work. People pass in the toughest exam also, bache. So I don't think there should be any reason. So the question of ENT were designed in such a way to give you hints into real paper. Don't get really this panic that, that paper will be having some new word written. But today we learned few arts. Number 1, read all the statement and the 4 choices carefully of those questions which we know by heart. because we know. Remember that question of, anterior posterior packing failed to control bleeding. Don't assume, oh, it's the same questions. No, we have to really, read the question thought. Number one. Number two would be that, there will be some new word written in the question, but if the basic theme of question is matching my concept, I'll stick to the answer. And number three, most importantly, is howsoever unknown question may be in the paper, just keep in your mind very clearly, I will not let them spoil my type A and type B question. This is what the wisdom is. This is what if you write on the wall today also, I'll be a stable warrior. I will have my weaknesses, but I'll play my game well till the last second. I'll be a stable warrior. I have my weaknesses. I accept that, but I'll play my game really well till the last second within my own capacity, within my own limitations. I have my own capacity. Maybe my ortho may not be that great as my, maybe anatomy may be more great, but odds are not equal. But within my own limitation, within my own weaknesses, I will try to do my level best over there. So that is what a stable warrior is. I will behave like a stable warrior. I have my weaknesses. I accept that. But I will play my game well till the last second within my own limitation and within my own, drawbacks, whatever I have. But I will not let the unknown question spoil my known and partially known question. We all pray for your, success. May you really do well in the exam. May you be stable in the remaining days. May you be calm in the remaining days. May you be not discussing too many negative things with other people. May you maintain that hope of passing a life within you. That's the most important thing. Okay. So thank you very much. I'll take your leave now. If you have any question, you can always, scribble in the Telegram chat. I will keep it active for a few days.